Hello, today I will be presenting on the healthcare organization I studied this semester, Open Cities Health Center, which is located in St. Paul, Minnesota. I will discuss the history of the organization, its mission, vision, and values, the leader I interviewed, the leadership style that he demonstrates, and one important improvement effort currently happening in the organization. Open Cities Health Center began in 1967 as a completely volunteer-run organization created by community members who wanted to expand access to care. During the 1970s, it grew from offering basic immunizations and education to providing maternal health care, vision services, podiatry, and full medical care. In 1985, it officially became a nonprofit organization and continued to expand its services. Today, it is a federally qualified health center, which means it serves anyone regardless of their ability to pay. The patients who come to OCHC include immigrants, refugees, and low-income families who often face barriers accessing traditional healthcare. The mission of Open Cities Health Center is to provide accessible and high-quality healthcare to all people, especially underserved communities. Their mission highlights cultural competence, inclusion, and community well-being. Their vision is to be the preferred provider of compassionate and equitable healthcare across the Twin Cities. Their core values emphasize patient-centered care, community engagement, and whole person wellness, which includes physical, mental, and social health. They also strongly value diversity, inclusion, and health equity, which guide how they care for their patients. Open Cities Health Center uses a dual leadership structure. The board of directors serves as the governing body and is made up of volunteer members from the community. They focus on long-term strategy and ensuring that the organization stays aligned with its mission. The executive leadership team manages the day-to-day operations of the clinic, oversees staff, ensures quality care, and works directly with community partners. This structure helps the organization stay both mission-driven and responsive to the daily needs of patients. The leader I interviewed was Dr. John S. Pearson, the Chief Executive Officer of Open Cities Health Center. Dr. Pearson has a strong academic background, including a bachelor's degree from the Citadel and a master's degree from Central Michigan University, and a doctorate in health administration from the Medical University of South Carolina. He is also a retired U.S. Army veteran who served around the world as a medical evacuation pilot and a healthcare operations officer. In the military, he held leadership positions such as executive officer at the U.S. Army Medical Center of Excellence and chief operating officer for the U.S. European Command Surgeon's Office. Before joining OCHC, he also served as CEO of other community health organizations, which shows his long-term commitment to public health. Dr. Pearson describes his leadership style as a mission-driven, collaborative, and focused on service. Based on the interview, he demonstrates transformational leadership because he motivates staff through shared values and a clear sense of purpose. His military background helps him create structure and clarity, but he balances this with compassion and flexibility. He also demonstrates servant leadership because he prioritizes meeting the needs of the community and supporting staff and removing barriers that affect patient care. Finally, he uses a collaborative leadership style, meaning he actively includes staff in decision-making and builds strong partnerships with other organizations to expand community resources. One of the most important improvement efforts currently happening at OCHC is the expansion of behavioral health services. This includes integrating mental health care into primary care visits, hiring more bilingual mental health providers, and reducing long wait times for counseling and psychiatric care. Dr. Pearson shared that many of their patients have experienced trauma, including war, displacement, poverty, discrimination, or chronic stress. Because of these challenges, OCHC is prioritizing the expansion of mental health support to better care for the whole person. Why does this behavioral health expansion matters? This improvement effort matters because many of the populations OCHC serves face high levels of trauma and stress, and cultural stigma may prevent them from seeking help. Providing integrated and accessible mental health services helps treat both physical and emotional needs. Expanding behavioral health aligns directly with OCHC's mission of health equity and its commitment to whole person wellness. OCHC has several strengths that support its mission. The clinic employs multilingual staff who helps patients navigate appointments and paperwork. They offer a sliding fee scale so patients can receive care regardless of their ability to pay. The organization is known for cultural competence and for building strong partnerships with community groups, schools, faith leaders, and public health agencies. They also have mobile health outreach, which brings healthcare directly into neighborhoods that need it most. In conclusion, Open Cities Health Center is a deeply community centered organization with a strong mission of improving health equity in the Twin Cities. The leadership of Dr. Pearson reflects commitment, service, and collaboration. The organization continues to grow and improve, especially through its behavioral health expansion, which directly supports the needs of the populations it serves. Overall, OCHC is a model example of a federally qualified health center that stays grounded in its values and dedicated to reducing health disparities.